Okay. So I don't remember which order they discuss the different shank muscles, but on the medial and lateral surfaces of the lower leg, we've got sets of 3 muscles on each side. And we need to follow the tendons and free those tendons up from the malleoli, lateral malleolus and medial malleolus, to be able to identify those. And before we start on those, just to cover the anterior muscles, the extensors that are located on the shank, the most superficial and largest of these is Tibialis cranialis, or Tibialis anterior. And this muscle has a tendon that runs over the anterior surface of the ankle and then goes down medially onto the tarsals and is responsible for dorsiflexion and also for inversion of the foot. And then deep to that are a couple of muscles that we can usually see at least one of these in the cat. And this is the Flexor Digitorum longus. And there's an extensor Hallucis longus also, which is usually fused to this or difficult to distinguish in the cat. And the tendons for that run down the dorsal surface of the foot to extend the digits and are joined by an extensor digitorum brevis that has tendons that join those on the way out. Now on the medial malleolus, we have 3 tendons that go behind the medial malleolus, and usually I like to see if you guys can separate those a little more, but it takes a long time to work through that tough retinaculum that runs down across the ankle there. But the most superficial of these, and probably the largest, is this tendon right here. And you can see the muscle. If we look up at the origin of the muscle, it originates underneath the popliteus muscle, or the insertion of the popliteus. So the popliteus is coming from the lateral epicondyle on the femur, crossing behind the knee joint, and then inserting medially onto the proximal half or third of the tibia. So this is the border of the popliteus coming down right here, and underneath this is this Flexor Digitorum longus. And if we clear that up a little bit, we'll see that medial or lateral to that is a large muscle whose tendon also goes behind the medial malleolus. And I'm holding this right here. It's a big, pretty extensive muscle that goes up the back, originates from the back of the tibia and fibula. And this is the Flexor Hallucis longus. And we can follow that tendon, should follow that tendon back. And you'll see that those both go into the flexor plate here. And in between those, just deep to the Flexor Digitorum longus, you'll see another tendon that goes right behind the medial malleolus that comes from a small muscle buried between the Flexor Digitorum longus and the Flexor Hallucis longus, and that is the Tibialis Caudalis. So Tibialis cranialis is located here on the anterior surface, and there's a little Tibialis Caudalis that comes back here behind the medial malleolus and goes at an angle onto the tarsals. And both of these together act to invert the foot, or the sole of the foot, and Tibialis cranialis, as I mentioned, is a dorsiflexor. Tibialis Caudalis, along with these flexors, digitorum and profundus, help to plantar flex the ankle. On the lateral surface of the shank, if we look at the lateral malleolus, one of the tendons, the most superficial, goes kind of cranial to the edge of the lateral malleolus. It really comes right across the lateral side of the lateral malleolus and then goes into the tarsals laterally. And this is one of the peroneus muscles. So we have two peroneus muscles in the cat, peroneus longus and then peroneus brevis. And peroneus brevis is not this tendon here, but the big muscle behind it that it's not cleared up here, but collects as a tendon to go right behind in the trochlea or trough behind the lateral malleolus. And in between those is a third muscle that is Flexor Digitorum or Extensor Digitorum lateralis. And this muscle goes behind the malleolus, and so it seems unlikely that it's an extensor, but we haven't cleared away the tendon behind the lateral malleolus, but this is its tendon right here on the lateral surface of the foot. And that tendon goes up on the dorsal surface of the metatarsals and out onto the phalanges. And so that is the Extensor Digitorum lateralis. So we've got peroneus longus, this large peroneus brevis, and it's just lateral to the big flexor hallucis longus right here that we saw on the other side. And the peroneus complex, longus and brevis, go behind or over the lateral malleolus. Flexor hallucis longus and the flexor digitorum longus both go behind the medial malleolus. And then we've got flexor digitorum brevis on the plantar surface of the foot that have tendons that join the flexor digitorum, which, by the way, I should mention these flexor tendons for the digits run across the calcaneus as a calcaneal cap of connective tissue that continues up into the calf muscles as the flexor digitorum superficialis. So in between the heads of the gastrocnemius, the lateral head and the medial head, is this band of muscle or thick column. That's flexor digitorum superficialis. And its tendons run in the calcaneal tendon or Achilles tendon to form a cap over the heel and then continue out to the digits. And the brevis sends muscle to those tendons. Okay.